Doctors can have privileges of admitting and discharging patients from the hospital. Nurse practitioners do as well, but a lot of nurse practitioners don't actually act on admitting. They do more of a discharge planning for those, and more of those nurse practitioners are the adult nurse practitioners and the pediatric nurse practitioners. The other difference is that nurse practitioners don't really roster patients to us per se. So rostering means that you are actually sign a paper saying that you will only doctor with this physician, and on the government spreadsheet that they have, you belong to X, Dr. X sort of thing. So that's what rostering is. Whereas nurse practitioners do not have that ability to do that. The doctors have a roster size that they're solely to take care of. And the requirements for them to have at a part-time practice is 600. For a full-time practice, it's 1,200 patients or more. Sometimes up to 1,500 is what they're required to have. Their standard for seeing patients is every 10 to 15 minutes. And that is kind of their standard. And so they are going through quite a number of patients on a weekly or on a daily basis, I should say. And they also have other responsibilities as well. So within our family health team, we have 15 physicians that work within our community here in Goderich. And they don't only provide patient care within the family health team and primary care, but we have several physicians that have other responsibilities outside of providing primary care. So a lot of them will do the emerge, staff the emerge outside of their office hours. They will do inpatient care. They will assist in the OR. Some will even do, some are anesthesiologists as well as a family physician. One of our family physicians here is a coroner, and so he will go out to sudden deaths within the homes or do any coroner cases that are needing to be done. And some of them actually also provide assistance to Maitland Manor, which is the nursing home in town. And so they don't only have their office that they have to work in at the family health team, but all of these other responsibilities around in the community as well. Some actually work within Healthy Hearts, which is a cardiac rehabilitation center at the YMCA here locally. So there's lots of responsibilities that they have. As nurse practitioners, we don't necessarily get involved in those because we're in the office Monday to Friday, 9 to 5. So we have very little time to get involved in those other areas. And probably means that we could get involved in if that was something that we wanted to, or if it was agreed upon our coworkers and our team. But mainly we're hired by the family health team, so we have to kind of listen to what the family health team wants us to do. Whereas the physicians, they're actually their own bosses, so it's like it's their business is their office. So that's the other thing. So they get paid directly from what they bill. So they bill for all of their appointments, and they also get a certain amount of money for having a number of people in their practices, and how complex those patients may be or how they may not be complex is how they get their money on a yearly basis. So there is a difference in the paying of the salary base of both professions, as well as practice differences, and then also responsibilities. There is differences with the responsibility. As far as answering to our colleges, they do have to answer to the OMA, which is the Ontario Medical Association. They have chart audits. They have strict guidelines that they have to go through, and they do have to meet the requirements of their college in order for them to maintain being licensed year after year. And usually that is credited education that they have to do in order to keep their license going, and several other requirements that they have to follow. Very similar to us as nurse practitioners, we have to also do a quality assurance program. We have to, if we're chosen to do it, maybe do chart audits. We may have to do an OSCE, which is like a physical exam on somebody and be assessed through doing that. And we also have to keep up to date with all of our education, and we have to answer to our college in saying that. Even though we have the Nurse Practitioner Association, we still are licensed with the College of Nurses of Ontario, and that's where we have to answer to as our governing body. So both of those are the same for both professions. So current job prospects. I'm not 100% sure what they are in Ontario right now, to be quite honest, but I do know that the prospects might change depending on our government. Let me put it that way. Currently, right now, there is a job or a wage freeze for our sector, so it does limit the amount of wages that we are getting on a yearly basis. And that may actually affect funding to family health teams and may affect job prospects as well down the road. I do know that a lot of rural family health teams do kind of have difficulties keeping nurse practitioners within their roles, within those facilities. And I'm not sure if it's because of personality conflicts within the team, or if it's the wages, or if it's the workload. It can be probably a mixture of all of those for individuals. But I do know that there is job openings, there is job postings all the time that I do see on our website with our association and on various other websites. Across Canada, there is opportunities everywhere, to be honest. And there is lots of provinces that are really trying to have more nurse practitioners available to them. I know in Ontario, we have the most nurse practitioners Canada-wide. As far as salary goes, I would say out west is probably paid the highest. Ontario's kind of middle of the road, and out east is paid the lowest as far as an annual salary. The responsibilities are basically pretty much the same across Canada. There is certain provincial limitations on nurse practitioners. So in some areas, they are not allowed to prescribe opioids, but we are here. I think out west they are as well. So it may depend on what province you go to what the job prospects are and the and kind of the limitations of the role, basically. I cannot speak to what the job prospects are for adult or pediatric, because that's more hospital based. But I do know that there are more and more job openings that could be coming in those sectors. There is also nurse practitioners within the community care access, or I shouldn't say that, the LIN, which is basically providing home care and palliative care. So there is different roles that are coming up that of nurse practitioners that people could definitely go into. But some of those depend on the funding from the government. And so depending on what we're going to be getting with this new government that's just been voted in, depends on what the job opportunities could be for the future for sure.